Manipulation under anesthesia, most people don't realize, is actually going on 100 years old. It was developed in the 1920s by osteopathic physicians, and the primary reason it was developed was for people who had intense, intractable pain due to bulging discs or herniated discs in the low back. And over the years, it kind of got shied away from, because when it was first created, MUA used a general anesthesia, hence the term manipulation under anesthesia. Well, there are obviously a lot of risks associated with general anesthesia. But over the course of the last 8 to 10 years, there have been a lot of advancements in certain anesthesia medications, where now instead of having to do an IV, or instead of having to do a general anesthesia, we can do an IV anesthesia, which is much, much safer. And it is very fast metabolizing in the body. So as soon as the IV is done being administered, the person is literally alert and awake 15-20 minutes later. The whole purpose of doing a manipulation under anesthesia procedure is twofold. First of all, when you have somebody who's in an intense amount of pain, it allows us, the practitioners, to take that person's joints, discs, muscles, ligaments, etc., through what their normal complete ranges of motion should be. However, in the awake clinic setting, oftentimes that can't happen because the pain limits your ability to get into those positions. Secondly, when you've had long-standing pain and you've had a long-standing joint problem, which causes a lot of chronic inflammation and a lot of chronic muscle spasming, the IV medication allows the muscles along the spine and joints to relax. And as soon as those muscles can relax, then we can stretch those joints out to get through their normal full flexibility. MUA is typically done over 3 days in a row, and the reason we do that is, again, typically because of the length and the severity of the injury that most people are having this done for. Bear in mind that manipulation under anesthesia is kind of that in-between procedure between in-office conservative type management, whether it be chiropractic care, physical therapy, even epidurals or other steroid type injections, and on the other end of the spectrum, some type of spinal surgery or hip replacement surgery, etc. And this is kind of that in-between treatment, and it really helps a lot of people avoid the potential risks of back surgery. It is much cheaper and more cost-effective than back surgery, and the results are fairly immediate. We've had great success here in the clinic with the patients that we've been doing it on. We've been doing it, Dr. Strockman and I have been doing it since 2006, and one of the only groups of physicians in the entire state of Michigan offering the MUA procedure. And the results are really just incredible. I mean, to see people who were literally not even able to function in their daily life that are now picking up their children again, or people who couldn't go out in the yard and work in their garden or rake leaves or even push their lawnmower. And we're getting these people back to their normal, regular life in a short period of time, oftentimes even within a week after the procedure. So it's an incredibly effective tool, and we're really happy and we're proud that we provide it here.